read from the newspaper that soon, or you fear that this support may end, or is not as stable as you think?
The the the
How do you feel
program
about this?
the program really, in the beginning we did not really expect that this can really be forever, that there will come a time that this could not be sustained anymore, or that this funding will stop. And we have in fact prepared for that, because even earlier we had been already talking to PhilHealth
Yes.
to come in, because our idea is that it is more sustainable if the financial scheme to support this patient is on the social insurance side. So PhilHealth in 2014 started also its Z package for leukemia. We began with leukemia. And from the ordinary 45,000 benefit package, they provided for leukemia 210,000 pesos in the beginning to support for the treatment of the whole 3 years of treatment for leukemia. Now, it only would support for the cost of the chemotherapy drugs. But because we still have the medicine access program of the free drugs to support an addition, but PhilHealth now has prepared itself, has already increased the benefit package to 500,000. Late last year, they have approved it. I think November, December of last year, they have increased the benefit package. And now we feel that this is now enough to cover for everything. The antibiotics, the blood products, the antiemetics, the laboratory tests of this patient. But the plan is that the free chemotherapy drugs will only be this year. Although PhilHealth has already kicked in, we are still leaving a lot of the non-leukemic patients. About 30 to 40% of these patients will have no way of getting access to a free chemotherapy drugs. So, the PhilHealth first should be ready so that they have the whole benefit package for all types of cancer in children. And I believe that we still need this year and next year, and I believe PhilHealth probably will be ready in order to have the benefit package for the other types of cancer in 2018 or maybe late 2017. So if we will stop the free chemotherapy drug this year, we will be leaving a lot of these patients without any support of chemotherapy drugs next year. So our proposal is not to stop this program this year, but continue it to 2017 or even part of 2018 until the PhilHealth program will kick in.
How do you plan to convince the DOH to
We
continue
had,
that?
yes, we have already begun talking with DOH, and in fact, fortunately, they are listening. And there is a great possibility that they will in fact extend it to next year. At the same time, we already began talking with PhilHealth, because we are providing also the technical support to PhilHealth on the costings of the other types of cancer in children. So what I'm saying is, we know what will happen if we stop. We have talked to the right authorities that the transition plan in terms of the timeline should be well studied, and they are listening. So we continue to be vigilant, that we support our advocacy, that we are in the right direction, that we follow this course of really preparing the transition, and that there should be a good coordination of the Department of Health's free medicine access program and the PhilHealth, so that there is coordination in the timing of when this free drug program ends and when the other program begins.
On on a more personal level, ano, kasi your passion is really amazing, and you've been behind this program ever since. And from our talk, that I could see that you've been really behind this all this time. Can you describe to me how the program has, touched you or changed you as a director, maybe, or even in a personal level?
Yes, it actually began way back when I was a resident at the Philippine General Hospital in the 1980s, early 1980s. These patients are quote unquote forgotten, they are left there to die. There is even no decent place for them, for us to see them. We see them usually in benches in the hallways, in corridors. And almost all of them will die. You see these patients early in the year. It's a miracle if you will see them at the end of the year. Almost all dies. Now, very early, I saw also that there are no specialists that are becoming interested in this type of disease. I had other plans. Oncology is not my plan. But I decided to focus on this because this is a need that I felt one should be interested in, and I volunteered that if nobody will be interested, I will be interested. When I came back after my training in the US, I saw the whole problem. Although I am available as a specialist, there are other problems, and then I began to realize that it needs the cooperation of all sectors in society to really ensure that kids will be cured of their disease. It is with my belief that has evolved from that beginning that children and cancer should not go together. And that with my personal belief also, if there is one advances in our technology, in medical progress, is in cancer treatment. If this is the best that mankind has developed, the first to benefit should be the children. And if whatever failures that we had, the first that should be saved from the failures should be the children. They should be the last to suffer from our failures, the first to benefit from our society's progress, and the last to suffer from our society's failure.